do it on Chapter 19, Infectious Diseases Manifesting on the Skin and Eyes. So with our skin, we have some important features that are there for mainly our protection. We'll go into that a little bit later. So the integument part of the skin consists of your skin, hair, nails, sweat, and oil glands. And then there are actually 3 layers of your skin: the dermis, the epidermis, and the hypodermis. We'll also get into those layers a little bit deeper in just a second. So back to the integument features of the skin. The skin is actually our largest organ of our body, and as we all know, it covers your entire body and has those 3 layers. So we have hair, and it grows in a lot of unwanted places, and it's actually a mechanical protection for our skin, and it aids in regulating our body temperature. Our nails are protection for our fingers and our toes, and it helps enhance the sensations of things that we feel. Sweat glands, even though kind of gross, they help fight, they keep our body from overheating and fighting off dehydration. And it also moisturizes and cools the skin. Oil glands produce sebum, which helps the skin from drying out. So here's the layers of the skin, and we'll talk about the epidermis. This is your first layer of skin, and it helps protect the body from harm. It helps block the UV radiation, and it also contains the melanin, which is what pigments your skin and provides skin color. The more you have, the darker your skin will be, or you could be like me and be pale as snow. The dermis is the second layer of skin. This is composed of collagen and elastic tissue. This layer includes our nerve endings, the hair follicles, and the glands, those sweat and oil glands we were talking about earlier. And last we have the hypodermis, which is the bottom layer of your skin. This stores energy and connects your dermis to your muscle and your bones. This layer also helps insulate the body. There are some normal biota of the skin, like Staphylococcus epidermis, Staphylococcus aureus, and micrococci. So Staphylococcus epidermis, it can cause infections from implanted medical devices. This bacteria can actually hide in the body for long periods of time, and the immune system doesn't really find it, so it can't really fight it off because it doesn't realize it's there. These are mainly your boils and wound infections, endocarditis, and other skin inflammations. If it gets severe, it can actually enter the bloodstream and cause nosocomial sepsis, which is very, very bad. Next we have Staphylococcus aureus, and this is found in the upper respiratory tract. This is what causes your infections like pneumonia and bacteremia. This microbiota can easily stick to the host surfaces and has a very invasive potential. Washing your hands is the best defense, but you can also keep your wounds covered, wash your bedding and clothing, and take food safety precautions to keep from the spread. And last we have Micrococcus luteus, which is part of the normal skin microbiota. Its contaminants come from skin and mucous membranes. The causative agent, this is the causative agent of intracranial abscesses, pneumonia, endocarditis, and meningitis. It can withstand massive doses of UV radiation, but it is susceptible to most antibiotics. MRSA, I'm sure everyone's heard of MRSA. They call it the superbug, mainly because it has become resistant to so many antibiotics. Some early signs of MRSA to look for would be those swollen red bumps. They're usually draining pus. It can be painful to touch the area, and it'll be warm to the touch, and it's usually accompanied by a fever. You can simply prevent this by washing your hands and covering wounds. Next, we'll talk about some of the anatomical features of the eye. We'll talk about the conjunctiva, which is a mucous membrane, and it covers the front of the eye and lines the inside of the eyelids. The cornea is kind of dome-shaped, and it also covers the eye and controls the amount of light that enters the eye. Next, we have the defenses of the eye. These are your eyelids, eyelashes, and tears. Your eyelids help from keeping harsh light out of your eye, and they also keep from harsh objects getting in because they close completely over the eye. Your eyelashes, they help catch dust and debris, and they also help keep those harmful objects out they keep them from irritating the eye. Your tears, they're good for keeping your eye moist, and they also flush unwanted particles. So if you get something in your eye, you notice that your eye kind of tears up a lot. That's kind of a defense mechanism, just to try to get it out of the eye. So there is some normal biota of the eye. First, we'll talk about the streptococcus. This can lead to decreased vision, and it is seen in disorders such as conjunctivitis and keratitis, which we'll talk about in just a little bit. Next, we have Propionibacterium. This is the white intracapsular plaque. It's caused a delay after cataract surgery. And then we have Corynebacterium, which under homeostatic conditions thrives on the eye, but it also helps boost the eye immune defenses. Next, we'll talk about conjunctivitis, which is commonly known as pink eye, and it's an inflammation of the conjunctiva. So this is caused usually by infection or allergies, and you get the pink, puffy, itchy, red eyes, and sometimes you'll get that fluid that leaks out and it's kind of crusty on the eyelashes. This can be either bacterial or viral. Usually a doctor will prescribe antibiotic eye drops to clear it up. Next, we have trachoma, which is caused by the bacterium Chlamydia trachomatis. This can cause blindness or visual impairment. It spreads through saliva or skin-to-skin contact and contaminated surfaces. There is an active phase and a scarring phase. Antibiotics usually treat the early stages, but surgery is needed for later stages. Next, we have keratitis. This is also known as a corneal ulcer. Inflammation or irritation of the cornea. It's caused by wearing your contact lenses too long or any damage caused by those lenses. Eye redness, pain, and blurred or decreased vision are some things that can happen with keratitis. This is usually treated with antibiotics and sometimes antifungals. Last, we have river blindness. So this is caused by a black fly that breeds near rivers and streams, and it's spread by repeated bites from that black fly. So it's mainly found in African villages and can cause blindness. Nodules and itching may develop, and signs may develop years later, not right off. Medication is given to kill the parasites.